My name is Kieron Lim. I am a gastroenterology and hepatology specialist practicing at the Mount Elizabeth Hospital in Singapore. Prior to starting my practice at Mount Elizabeth, I was at the National University Hospital in Singapore, during which time I was appointed as the head of gastroenterology as well as the medical director for liver transplantation at the National University Centre for Organ Transplantation. From quite an early point in my medical career, shortly after graduating from medical school, I had the privilege of working at the Royal Free Hospital in London, which was one of the major liver transplant centres in England. And I had been exposed to liver disease and liver patients quite early in my medical career, and it had liver transplant can completely change a patient's life after the operation. So, as I alluded to earlier, we often see patients with liver disease and patients being in hospital, being quite unwell, requiring recurrent admissions to hospital, how the liver disease affects their life, their ability to work. And for myself, having been able to work at a major transplant centre both in London as well as in New York before coming back to Singapore, I had first-hand experience looking after and caring for such patients and journeying with them through from when they were very ill in the hospital all the way through the operation and seeing them leave the hospital and return back to work and to their normal lives and to enjoy their lives with their families again. And that has, to me, is a very meaningful part of medicine. So, liver disease can present in a wide variety of ways. Some patients with significant liver disease are actually asymptomatic. They feel totally fine, and the only way we will discover that is on routine blood testing or routine scans, surveillance scans. However, some patients actually develop significant symptoms, and these include being jaundiced, where the skin and the eyes are coloured yellow. Their abdomen can become bloated and distended, filled up with fluid, as much as 10, 12, even 15 litres. Some patients with advanced liver disease have confusion, or we call that hepatic encephalopathy, because the liver is unable to clear toxins in the body and the bloodstream. This results in a buildup of ammonia, which then goes to the brain, and this may manifest as poor concentration, reversal of their sleeping pattern, all the way to confusion and a deep coma. Another commonly encountered complication includes bleeding from blood vessels in the food pipe and the stomach, known as varices. So these are some examples of how liver patients with end-stage liver disease can present. So I think patients or individuals with no history of or family history of liver disease, such as hepatitis B, liver cirrhosis, or liver cancer, and they feel well in themselves, they should still go for regular health checks or health screenings. This can look at their liver tests, as well as their cholesterol and their glucose tests, perhaps also a scan of the liver and the gallbladder. In patients who have a family history of liver disease, or individuals who consume significant amounts of alcohol should also go for regular health checks. And this includes, we'll look at liver tests as well as the glucose, cholesterol, as well as screen them for hepatitis viruses. And if they are not immune to them, we should suggest that they get vaccinated against these liver viruses. Gastroenterologist in hepatology is an aspect or a facet within the specialty of gastroenterology. Specialists who choose to go down the subspecialization of hepatology and transplant hepatology have extra training where they focus on such very sick liver patients. Our role as transplant hepatologists is to follow the patient through from their illness with decompensated liver disease, to work them up and prepare them for the liver transplant, as well as to look after them, these post-transplant patients, for many years after their transplant. And we will primarily focus our attention on medical aspects such as immunosuppression, looking after potential complications from immunosuppression medication, ensuring that not only the new liver works well, but also other organs that may be affected by the transplant process and by medications after the transplant are also functioning well. For example, their kidney function, their cholesterol, cancer surveillance. So all these things are under the remit of the gastroenterologist and the hepatologist. I think there are two main groups of patients that should be considered and evaluated for liver transplant. The large majority of patients that fall into the first category are patients with liver cirrhosis, and in particular patients who have more advanced cirrhosis or complications of cirrhosis. This is also known as decompensated liver disease, and I referred to this earlier on about such complications. These include jaundice and encephalopathy, as well as the development of blood vessels called varices and bleeding from such blood vessels. And last but not least, the development of primary liver cancer or hepatocellular carcinoma. So patients who have such complications should certainly be referred to and evaluated at a liver transplant center. So when liver transplant first started about 50 years ago, the success rate or the survival rate at 1 year was actually quite low and quite poor. Statistics show that the 1 year survival rate when transplantation first started was somewhere between 20 to 30%. Over the last 50 years, because of improved surgical techniques, better intensive care, improved medical therapy with more advanced, more sophisticated medications, and for the clinicians as well who have become more experienced in looking after and looking out for such patients, the survival rate has increased to close to 85 to 90% after 1 year. So I think it's no longer viewed as a procedure associated with a very poor outcome, but now patients are able to lead very normal lives, and in some large centers with a very long history of performing transplants, 10-year survival is greater than 65 to 70%. And some centers even have 20-year data, which suggests that up to 50% of patients are alive 20 years after their transplant. So I think the initial view or misconception that liver transplant is almost a death sentence is no longer the case. I think the largest challenge that we have is the donor availability. So like many countries in Asia and Southeast Asia, our cadaveric donation rates are quite low compared to the West. So this has pushed centers in Asia to develop their living donor liver transplant programs. In Singapore, we have both cadaveric liver transplants, which are enabled to meet the demands of the number of patients on the waiting list. And most of the transplant centers in Singapore get around that by being able to offer living donor liver transplants. Predominantly, the donors are relatives of the patients. However, in Singapore, on a case-by-case basis, patients who have emotional relationships to the potential donor, this donation can be considered and has been approved in the past by our National Transplant Ethics Committee. So in Mount Elizabeth Hospital, we are privileged to have a large team of experts in various fields of liver transplantation. Such specialties include, of course, liver transplant surgeons, transplant hepatologists, as well as critical care specialists, infectious diseases specialists, as well as a very specialized nursing support, nurses in ICU, in the operating theatre, in anesthesia, and all these are specifically trained to look after such complicated and complex cases of liver transplants. So liver transplantation is inevitably a very daunting procedure, both for the patient's family, as well as their potential donors. But I would say that the care team will provide support, both medical as well as emotional support for the patient, the potential donors, as well as the family. And it is a journey that the medical team will take with you together, and to ensure that you are safely and adequately worked up for the transplant, through the transplant process itself, and also for long-term follow-up.